Hello everyone, my name is Kundlas and I'm a primary care physician. Welcome to our channel. Today we'll be discussing about osteoporosis, which is a very common medical problem, and the incidence is increasing as we are aging and living longer and longer. Bone is a very active tissue. Contrary to our belief, bone is not a dead tissue. Every day we make new bone, we destroy bone, and there is a balance between the new bone formation and the bone which we are taking off. Whenever this balance is distorted due to multiple reasons, we develop a condition called osteoporosis. If you look under microscope, the bone looks like a honeycomb. In osteoporosis, those holes and spaces increase and your bone becomes very brittle and weak, and you are at high risk for developing fractures and also leading to multiple complications. In United States, the incidence of fractures, especially involving spine and hip, is increasing, and that is one of the most common reason for morbidity and mortality in elderly. And United States spends a lot of money in preventing and for the treatment of osteoporosis. The osteoporosis diagnosis is very simple. You require a test called bone density test. It is very low radiation and it could be accomplished without any major preparations. When you get bone density test, you get two kind of scores. In the bone density test, your radiologist is measuring your bone mineral density. These two findings are Z-score and T-score. What basically is in Z-score, your bone scan is being compared with somebody at a younger age which has achieved maximal bone strength, and your scan is compared to that and a number is created. Score is for your age match population which are of same characteristic as you are. But for practical purposes, we'll stick to Z-score, and it is reported in a number between 0 to 2.5. If you have your test showing bone mineral density from minus 1.0 to minus 2.5, you have a condition called osteopenia, meaning your bone is brittle but you have not developed full-fledged osteoporosis. But if your Z-score is more than minus 2.5, you have full-fledged osteoporosis. Now, what can you do about that? Unfortunately, there are no major signs and symptoms of osteoporosis. Most of the time, the first signal that you have osteoporosis is fracture. So, we need to be proactive. In United States, it is recommended that everybody above the age of 65 should have regular bone density tests. You should talk to your primary care physician and it could be arranged very easily. In order to prevent osteoporosis, you need to have a balanced diet of calcium, vitamin D, and also you must exercise so that you could stress your bone, which leads to new bone formation and adds to the strength of the bone. If unfortunately you have developed osteoporosis, there are multiple medications which could be given in order to reduce your risk of osteoporosis. As always, please consult your physician, but this is a very important disease and you should not ignore it. And most of the time, your bone density test is done as part of your physical. Thank you very much for listening and watching this video. If you like this video, please do not forget to subscribe our channel for new content. Thank you very much.